People back home know that we need a new hospital.
Thank you, Madam Deputy Speaker. Let's be clear from the beginning, corridor care is unacceptable. No patient should be treated in a corridor. No family should watch a loved one receive care without the privacy and the dignity that they deserve. And no member of our brilliant NHS staff should be put in the impossible position of delivering care in an environment they know is not right. I know how deeply my constituents in Warrington South feel about this, and hardly a week goes by without someone contacting me about their experience of Warrington Hospital. They tell me about the kindness of the staff despite incredibly difficult circumstances. Others tell me about the length of time that their loved ones have been waited to be seen, and those figures are reflected. Those experiences are reflected in those figures. In May this year, Warrington Hospital recorded the second worst 12-hour A&E performance in the entire country. Those figures are deeply concerning, and it'd be wrong with me to stand here today and pretend otherwise. But if we only talk about A&E waiting times, we miss the bigger picture. Corridor care doesn't begin in a corridor. It begins when patients are medically fit to leave hospital, but the care or support they need at home is not yet in place. It begins when patient flow slows down, leaving emergency departments carrying pressures that they were never designed to absorb. It begins when a town like Warrington grows significantly without infrastructure keeping up.
I thank the Honourable Lady for giving way, and I absolutely agree with her that it's not about fixing the problem at the front door, but it's fixing the problem at the back door. Does she agree with me that closer integration of health and social care is part of the answer to enabling that flow through hospitals out into the community? And I hope during the summing up that the Minister might also consider carefully my amendment to the health bill, and I hope my honourable friend might also look at that on health and care integration.
Thank you. I think my honourable friend, I absolutely agree. I think the NHS system as a whole is very fragmented, and that lack of connectivity is a big issue, social care being a core component of that, and that needs to be a priority going forwards.
You should give way.
Yes.
I thank her for giving way, because of course we must fix the back door and help people get out of hospital quicker as well, but there is also a challenge with the front door, with too many people feeling that they need to go to secondary care for health treatment. Isn't that why it's so important that we fix the foundations of the NHS by having that shift to community treatment, so that fewer people feel that they have to go to a hospital in the first place?
I thank my honourable friend, and I absolutely agree with that also, and I will touch upon that in a second as well, specifically with Warrington as an example. I'm pleased that our local trust has already taken steps and is rightly treating corridor care and waiting times as a priority, but there is more to do. That's why I've been working closely with our local NHS, ministers and Cheshire and Merseyside ICB to move beyond talking about the problem and to start changing how urgent and emergency care works in Warrington. Together with our local trust, I've developed a 3-part pragmatic plan to improve health services for our town. Given the pressure on A&E and waiting times, the first priority is clear for us: a new urgent treatment centre for Warrington. In April, I was pleased to announce that proposals had moved forwards, with architects beginning the initial design work, and since then the proposal has moved forward again, and detailed design and site survey work is now underway. An urgent treatment centre in Warrington means families would not have to travel out of Borough for things like minor injuries, sprains, cuts, burns, infections, or a child with a fever who needs checking over. Conditions like these can still be serious, but they do not need the full resources of an emergency department set up for life-threatening situations like heart attacks, strokes and major trauma. An urgent treatment centre would help free up space in A&E for the sickest patients and improve the experience for others by helping them to get the right care in the right place. So easing pressure in A&E is the first step, but it is not the whole answer. Part 2 of my plan is about moving routine appointments, diagnostics and planned care into the community so people can be treated closer to home and the hospital can focus on the patients who need the most specialist care. But there is one issue that none of us can ignore, and that is the hospital itself. People back home know that we need a new hospital. They see it when they go to A&E and they visit relatives, and staff feel it every day. Much of the site was built in a different century for a different population and a very different NHS. We urgently need a new hospital. There is absolutely no question about that. Warrington, much to the deep disappointment, Warrington was never included in the previous government's so-called new hospital programme, despite warm words hinting to the contrary. So that brings me to the third part of my plan. modernising and replacing outdated hospital facilities built in phases while vital services continue to run. When I was elected, I said I would be honest about the challenges in front of us. Yes, Warrington needs the new hospital, but it also needs a proper plan and funding behind it, not just empty promises. So my approach is a pragmatic one. We must ease the immediate pressures today, build better services around the hospital tomorrow, and put Warrington in the strongest possible position for investment in the years ahead. That's what I'm fighting for, and I will keep challenging where challenge is needed. I will keep working with our local NHS where partnership is needed, and I will keep putting Warrington South first until we get this right, because my residents, in their time of need, and our excellent NHS staff deserve better.